Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about kidney failure warning signs to watch out for. When the kidneys can no longer adequately filter blood and remove waste, this condition is known as kidney failure. There are a variety of issues that, if ignored, may even put lives in danger. You can get checked as soon as possible if you can identify the signs of kidney failure. Possible kidney failure signs and symptoms. When either one or both kidneys are not functioning properly, it is called kidney failure. It can sometimes appear suddenly and be short. There are, however, some chronic kidney failure disorders that might deteriorate gradually over time. The majority of people show little to no symptoms in the early stages of kidney disease or failure. The disease develops symptoms as it advances. Depending on the degree of the kidney failure or any potential complications, these symptoms may worsen. You should be on the lookout for the following kidney failure symptoms and signs. 1. Extreme exhaustion. Early signs of kidney failure include weakness, fatigue easily, lack of energy, and even trouble concentrating. Normally, blood contains nutrients and oxygen will be distributed throughout the body. Blood will be contaminated if kidney function is reduced. Anemia can also be brought on by chronic kidney failure. There is a reduction in the number of red blood cells that should carry oxygen. 2. Sleeping problems. Insomnia, sleep apnea, or restless leg syndrome could be signs of kidney failure. When the kidneys are unhealthy, there is an increase in blood pressure on the channel walls, which is related to this. The heart should actually be at rest at this point. Additionally, the C-reactive protein level has increased CRP. The presence of acute inflammation is indicated by this elevated CRP level, which has an impact on the quantity and quality of sleep. 3. Dry skin that itches. Perhaps you do not consider itching skin to be one of the symptoms or signs of kidney failure. When the kidneys are unable to maintain the proper balance of minerals and nutrients for the skin, dry and itchy skin can develop in kidney failure patients. This may result in deviations from normal calcium metabolism and the development of calcium phosphate crystals in the skin. Your body's itching symptoms are brought on by these crystals. 4. Changes in skin tone. When the kidneys stop functioning, toxins begin to accumulate in the body. Changes in skin tone that may indicate kidney failure include the following: skin turns dull and pale. Gray or yellowish skin color develops, skin darkens in some spots. Skin that is thick and has bulges and deep wrinkles is yellowish in hue. The spots resemble blackheads. 5. Have a persistent urge to urinate. Patients with kidney failure typically have frequent urges to urinate, especially at night. The damage to the kidney filter is one of the reasons why persons with kidney failure need to urinate so frequently. Additionally, it can indicate a urinary tract infection. The need to urinate is therefore incomplete. Even so, there can be less urine produced even when you always feel the need to urinate. Acute kidney failure patients often produce only 400 milliliters of urine each day. 6. The urine contains blood. Normal kidney function involves filtering trash to create urine while maintaining blood cells in the body. Blood cells, however, can also be lost through urine when the kidney filter is damaged. However, having blood in your urine does not always mean you have kidney failure. The same thing can also be brought on by some other illnesses, like tumors, kidney stones, or other infections. 7. Foamy urine. Extra bubbles in the urine can potentially be a sign of kidney failure in its early stages. Like the foam that forms while beating eggs, the new foam will probably resemble that. 8. Foot swelling. Sodium is one of the minerals that the kidneys filter. Sodium retention can result from declining kidney function. This indicates that there is an excess of sodium in the body compared to what should be eliminated by urine. Swelling in the feet and ankles is one of the symptoms of sodium retention in kidney failure patients. 9. Muscle cramps. An electrolyte imbalance in the body can also be brought on by impaired kidney function. As a result, the body's calcium levels are low and phosphorus levels are uncontrolled. These different electrolytes are crucial for muscular function. Because of this, some persons who have kidney failure also feel muscle cramps. 10. Decreased appetite. Symptoms like a decreased appetite are frequent when you're unwell. These symptoms of kidney failure may be brought on by blood-borne chemicals that decrease the appetite and alter taste perception. It's possible that even the food you're about to eat may taste metallic. Kidney failure treatment. Depending on your symptoms, the underlying causes, and the severity of your kidney disease, your doctor will advise a course of action. The doctor will administer a number of medications to help prolong kidney function if kidney failure is confirmed by specific tests to be severe enough. In order to survive, patients with kidney failure need to receive the right care. These are some of the common therapies for kidney failure, treatments to maintain a healthy blood fluid balance. Your doctor could advise intravenous IV fluids if your acute kidney failure is brought on by a deficiency of fluid in your blood. Other times, acute kidney failure might result in you having too much fluid, which will cause your arms and legs to swell. Your doctor may prescribe drugs, diuretics, in certain circumstances to encourage your body to flush out surplus fluids. Drugs that lower blood potassium levels. Your doctor may advise calcium, glucose, or sodium polystyrene sulfonate Kyonex to avoid the buildup of high levels of potassium in your blood if your kidneys aren't effectively filtering potassium from your blood. Muscle weakness and dangerously irregular heartbeats, arrhythmias, can both result from an excess of potassium in the blood. Medications to raise the calcium levels in the blood. Your doctor might advise a calcium infusion if the calcium levels in your blood become too low. Dialysis is a medical procedure that can assist the body in filtering the blood. Hemodialysis involves 3 or 4 days a week of dialysis. Kidney transplant. The replacement of a healthy kidney with one from a donor when the original kidney is no longer functional. You should frequently evaluate the condition of your kidneys because the symptoms of kidney failure are rarely identified until later symptoms start to show. Particularly if you are at risk for kidney failure, such as if you have a history of diabetes or high blood pressure. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.